Hi, and welcome back to A Guide to Surviving Stroke and Brain Injury. Today is part 2 of emotional changes after stroke. As you can see, I have my little buddy here. I don't think you can see, but he's fiber optic and he's so pretty. So, in order for Thanksgiving and Halloween to just passed, I wanted to show you this. Plus, he's my buddy. But anyway, so today I want to focus on your behavior and the caregiver aspect of it, and just kind of talk to you about emotions continued. So I want to talk to you today about trying to be aware of how your behavior is affecting others. So yes, I'm kind of selfish because we know how it affects us. It's frustrating for us. We get angry, anxious, whatever. But how does it affect the people that are around us? This also you can talk to your general practitioner about too. But let's talk about the caregiver. What about them? So anger is often directed at the family or the caregivers. And like I said in my last video, it's because excuse me, they're around us most of the time. So the caregivers may feel strongly that the behavior is unfair. And it is, because you definitely don't deserve what we give you. But unfortunately, you're there. Other people aren't. So, but you're there to take care of somebody that you love, or it's your job, or it's someone you used to have strong feelings about, but now you're not sure. So emotions can escalate all around when people are tired and fed up. Which my family, obviously, I must have been really bad and acted horrible because they all left. And I wish they would have contacted somebody and asked them, like my doctors, if this was permanent or if this was going to pass. So sometimes anger and aggression can be avoided. So try to give the person you're caring for as much choice as possible. One of the things that anger us the most is we don't have a choice. They talk for us. They do things for us. Instead of asking us to try it first, they do it themselves. And that is taking away our independence. So much has already been taken away. And how can we regain that independence unless we try? Does that make sense? So ask them simple things. It doesn't have to be big things. It can be as simple as, hey, do you want to wear this pair of socks or this pair of socks? And have them choose. It may not seem like a big deal to you. You may just want to give us a pair of socks and call it good. But unless you deprive us of that choice, that's what is important to us. And it's important to me anyway. Pay attention. Don't ask them to do something you know they will not be able to do, as a failure is likely to cause them anger. So if they can't walk, don't ask them to get up and change the station on the radio. Don't ask them to go get the mail. But you can say, hey, do you want to watch this or this? Or what do you think about getting a present for so-and-so? Do you want to get this or this? Choices make us feel empowered. People are more likely to become frustrated and angry if they cannot think as clearly or as quickly as they did before the stroke. So reduce distractions when doing a particular task can help someone to focus and concentrate on what they're doing. when you're having conversation with somebody that has a stroke, don't just pop in and answer for them. Let them answer for themselves. It may take us longer. It may be frustrating for you, but in the long run, it'll cause less frustration and anger on our part. It is important not to get into angry or aggressive encounters, as it is likely to help anyone in this situation. It is also important to look after your own health and safety. Just because someone has had a stroke, it does not give them the right to hurt or abuse you in any way. So, if you need to call the cops, call the cops. If you need to send them somewhere else, for your own safety, I'm talking about safety, not inconvenience. Your own safety and well-being. Take turns. Have someone else come over. Whatever. But do something. Take care of yourself. Always. There are coping techniques for dealing with aggressive behavior that may help you. Explain that their behavior is not acceptable. Because if you don't put that line, draw that line, you can't cross this boundary with me. I won't know I can't cross it. Once you say that, I'm like aware of it. And you may have to tell me a couple of times because I could forget. That's very possible and frustrating for you too, but it's possible. But put those boundaries down, okay? Ask friends and family to support you by giving them the same message. So not only the stroke victim, but tell your mom, hey, don't give me any crap because I can't watch Gay today because I am so frustrated and angry with her, or she threw a phone at my head or something. But tell others why. Tell others your frustration. It will help you feel better and it'll help them understand why you're doing the things you're doing. Be firm but polite. There's no reason to have sarcasm towards us. But tell us, hey, this really bothered me when you did this. And I'm not going to put up with it. But that's polite. Being impolite would be, you did this to me, you did that to me, I'm not going to do it, forget you. You know what I mean? There's a difference. Use the word I instead of you. This is good for anybody without a stroke or with a stroke. But, for example, I feel really upset when you argue instead of, you really upset me. Do you see the difference? Explain that you are frightened or upset. Say, when you did that the other day, that scared me to death. I cannot believe something like that could come out of something like you. You know what I mean? Just walk away. That is the easiest thing, and no offense, but most of us can't chase you. But walk away. And reward or be positive about appropriate behavior. So this can reinforce the likelihood of it happening again. So don't treat us like a child unless we are one. But don't say, good job, since you didn't yell at me, I'm going to give you a gold star, or you can watch TV tonight. Don't treat us like that. But say, hey, I really appreciate that you handled that situation calmly like you did, and I really approve of that way. You see the difference? That's less threatening than degrading. Does that make sense? If any of this, is too difficult for you, then seek support by speaking to their GP or a psychologist or their speech therapist or whatever, because they're trained, you are not. Okay? It's hard for you to deal with these things when you're not coping like professionals would. You don't know what to do. You don't know what to say. So seek help. They're there for you too. Okay? So when you go to them, talk about how you're feeling. Talk about what you're thinking. Talk about what your fears are. And they may be able to dissolve a lot of them, because if my family would have went to my doctors and said, hey, Gay's behavior is so erratic and it's angry and she's crying and laughing and I don't know why, maybe they could have understood why, and maybe they would have known that it would go away. See what I'm saying? So inform yourself, ask questions, and hopefully seek out the answers to what you're looking for. Also, talk to their social worker. It offers short-term counseling while they're in the hospital for you. Can specialize in mental health. The psychotherapist may also help you. It uses a talking therapy to help you identify problems and find solutions. Their occupational therapist helps you with practical tasks and to adapt to your environment. Usually helps with specific concerns and draws on a range of other services. Mental health team provides help in the community during difficult periods. May involve home visits and include the support of a community psychiatric nurse. A clinical psychologist may work as part of a community mental health team or in a hospital. Can undertake a thorough assessment of mental health needs and provide individual and group therapy. They cannot prescribe medicine though, so. A clinical neuropsychologist has specialist knowledge of the brain and behavior, and they can provide an assessment of cognitive and emotional functioning. And consult the psychiatrist. Usually works as part of the community mental health team, has overall responsibility for the patients, can provide therapy and prescribe medicine in case the anxiety is too much or the anger is too much. Therapy is also available privately, but the costs vary according to your insurance. There might also be local organizations that you can contact which offer counseling. Many people benefit through talking through their difficulties, okay? But if your stroke has left you with a problem communicating like me, or understanding others like me, this may not be so easy. You will probably require the specialist skills of a speech and language therapist. So as you all know, I had Allison who did a video on here for me, and in my last video I talked about I'm thinking about calling her again, and it's not so much for talking, it's for cognitive. It's for learning how to express my feelings again, because when I do, I get all flustered and I get frustrated and the words don't come out right and I make people mad that I don't mean to be mad, and I come off as accusatory instead of I'm problematic, you know. And so I'm thinking about contacting her again to help me with this. There is an organization called Connect that you can contact. They aim to find you the right tools to make communication possible. So, I'm sorry, I have a cramp. They also offering counseling service to people with communication problems, although the service is currently limited to people living in London. I don't know if they have one here in the U.S., but if they do, find them. That's what research does for you. Looking after yourself. So it's important that you are helped to find some way to make your future life as meaningful and fulfilled as possible. So keeping up your morale is a crucial aspect of your psychological well-being. Those around you can contribute to this greatly. They should understand and should ensure that they understand the reasons for any change in your behavior or emotions after a stroke, so they can make sense of what happened and help as much as possible. There are also many things you can do yourself to improve your psychological well-being. So I got this information from stroke.org.uk. So a lot of this is for the UK. But there are many organizations, if you research, that are here in the US. So seek out groups that have brain injury. Search out groups that are dealing with strokes alone, because only they can understand. There are, like Al-Anon, there are groups for caregivers that can talk about their frustrations with other people that are caring for stroke and brain injury patients. Men, I feel so bad for you, because it's probably harder for you, because people are probably more bewildered at why you're acting the way you are when you don't even know why you're acting the way you are. So talk to somebody that understands. There are people out there that get it. You just have to do the research. If you can't, have your caregivers do the research for you. Have them take you to the groups. Find a friend that had a stroke, like I did with Jessica and my friend Dave and Cindy and Tony, and there's a whole bunch more that I found out that had a stroke after I had mine. But usually people that have had a stroke are more apt to talk with other people that have had a stroke. So please, you're not alone. Just find someone that you can talk to, because people that have not had a stroke, they don't understand, and they could never understand. Thank God they can't truly understand what we're going through. But caregivers, be sympathetic, but also take care of yourself. Stroke survivors and brain injury survivors, do take care, manage your own well-being. Don't wait for others. You do it, because nobody else is going to be a better advocate for you than you. So celebrate every victory, every triumph, little or small. I mean, little or big. that was good. You can tell I had a stroke, huh? But I love you, and hopefully I'll be on here again to give you another informative video. Love you guys. Bye.